San Mateo, California. He also works with one of my DSOs in Hawaii, Diamond Plus provider. Diamond. Okay, well we'll be Diamond Plus pretty soon.
Diamond Plus next quarter.
Yeah, next quarter.
What does that mean? How many cases do you do?
200 a quarter.
200 a quarter.
You guys need more chairs?
Oh, you can sit there for
A lot of plastic.
A lot of plastic. So, UOP graduate, you guys will really get a lot out of this lecture. We do things a little bit differently. We bring the hygienists and the doctors into the rooms together.
Sorry.
That's all right. I do this on purpose because the doctors and the hygienists work as one team, right? And the message that you're delivering to your patients should be succinct. And it was really coincidental. I think when I spoke with Dr. Coddington, I spoke with Dr. Pope, that their philosophies were very in line, and that's why he's here today. So really looking forward to this. We had a great meeting in New Mexico a couple weeks ago, and we were just really excited to bring you guys here. We're going to be talking about Invisalign Go. We're going to be talking about iPro. We're going to be talking about the iTero. A lot of great things, case selection. So you guys are really going to enjoy this. But like I said in the other room, the more questions you ask and the more engaged you are and the more feedback you can give to Dr. Coddington, the more you'll get out of this today. So without further ado,
Hey, welcome.
thanks for coming today as well.
So if you're a hygienist, raise your hand. I just want to see. Oh wow, a lot of hygienists. Wait, let me just see who you are. Okay, cool. And then if you've done an Invisalign case, raise your hand. If you've done 300 Invisalign cases, raise your hand. But let me see if you've done a case, raise your hand again. So you've been dabbling with some Invisalign?
I went to training 10 years ago in Lincoln, Nebraska.
I just spoke in Omaha, Nebraska, just the night before last. Nice little town, never been there before. Anyways, all right, let's get started here. So I want to give you a little intro of my Invisalign story because it's a little different than the normal story in that literally like less than 10 years ago I wasn't doing any Invisalign. I had been practicing just general dentistry, doing tons of crown and bridge and all the basic stuff most dentists do. And then I found out my oldest son needed a heart transplant, so we had to move from Maui, where I was practicing in Hawaii, to Stanford, Palo Alto, San Francisco, Silicon Valley, to get him a heart. And when we went over there, at the same time, my best friend from dental school said, "Claude, I heard you're coming over here to get Jack a heart, and I just got diagnosed with leukemia. Can you babysit my practice?" Now his practice happened to be like right by Stanford, and this was my best friend from dental school in San Francisco years ago. So I said, "Oh yeah, absolutely, I'll help you out," because I needed to kind of work anyways, right? So the long and short is I walked into his practice the first day, and he had a big practice, like 35 years practice with like probably 1,500, 2,000 patients. And he said to me, "Oh, I forgot to tell you one thing. I have about 25 Invisalign cases going that are active that I need you to finish." I'm like, "Dude, I don't know anything about Invisalign. I've never done any Invisalign," right? He's like, "Don't worry, we'll get you trained up, and you can, learn how to do it." And he said, "You can call me and ask me questions." So I basically kind of took courses like this, and then went on the online academy on your Invisalign doctor site, which you've probably taken classes off that. And I just learned a bunch of stuff, and then just kind of dove in finishing these cases, and really started having fun with it. Because as you know, you do a lot of Invisalign. It's pretty fun, right? It's way more fun than doing composites on, second molars all day, right? Preps and all that kind of stuff. So the long and short is I kind of fell into doing Invisalign. And then once I started finishing those cases, I was like, wow, this is awesome, because you see these patients all day doing Invisalign, and they're stoked to see you, right? It's not like they're coming in to get a root canal or a tooth extractor or a crown, right? You have fun working on Invisalign patients, right? They're actually very pleasant to have come into your office all day long. But you'll see I kind of learned, as I started getting Invisalign, I kind of learned like, oh my God, the value of getting someone's occlusion proper and straight and their tissue healthy, and how that affects the longevity of their dentistry the rest of their life is really amazing. And I started seeing that because I've been practicing, this is my 38th year of dental practice. I've seen it all. And just to know that like the first 30 years or 28 years or whatever, I was like just doing bridges and crowns and veneers on any type of bite out there. It didn't really matter. wasn't paying attention to occlusion at all. And then I was going like, how come this stuff isn't like lasting a long time? How come that perfect bridge I did like 8 years ago already has to be replaced? And how come the tissue's already, always inflamed around it? And how come I'm not paying attention to this stuff? So when I started doing the Invisalign and seeing the results and hanging out with the people, and I realized like the dentistry I was putting in these patients' mouth looked so much better and the tissue was so much healthier, it just started to make sense to me. And so I guess what I'm trying to say now is like I'm in a completely different revitalized realm of my career in dentistry in that I pay attention to things that I never even thought I would pay attention to before, i.e. occlusion, and I'm really big, you'll see today, on airway. So my whole thing when I do comprehensive treatment plans is all about screening for sleep apnea, paying attention to airway, and then doing Invisalign to set up the occlusion. And then after I paid attention to airway and occlusion, then I do digital smile design restorative, right? I don't do any more restorative. I'm just doing Invisalign and sleep right now, both in Hawaii and San Francisco, and then teaching it. But I set up my general dentist to finish the restorative after I have the occlusion all dialed in. So if you're a practicing hygienist and your doctor that you're working with starts to do a ton of Invisalign, you're going to see that your patients are going to be like so much healthier. Like their tissues are going to be great. Like I have, in San Francisco, I have 3 hygienists, and they love me because all of my patients are like drive-by cleanings, right? Because they're all, 60% of my practice is done Invisalign, so everybody's mouth is just like dialed in totally, so the hygienists like don't have to struggle working around crowded teeth and struggling doing good hygiene appointments. So what's the moral of my Invisalign story? A, that I look around, nobody's really been, how long have you been practicing?
24. 10.
And Doc?
31.
31? All right, awesome. So some of the morals of the story I just told you about my thing is that obviously you're never too old to learn to do Invisalign, right? So don't think like because you've been practicing whatever it was you just said.
90.
90
days.
But don't think you're ever, beyond reproach in terms of time for learning to do something new in dentistry. And it really revitalized my career. I mean, I'm stoked to go to work now. And after like 20 years of doing drilling and filling, it's a hard job. Like, I mean, if you guys are just gonna do regular dentistry for 30 years, you better keep your body in good shape because it gets beat up, right? Like he's in good shape so he can handle it. But if you let yourself go and you're over there bending over doing root canals and extractions and fillings all day, that's not a pretty picture. So you're never too old to learn to do Invisalign, right? And then secondly, you never know what's around the next corner, right? Like I told you in Albuquerque, I mean, I had no idea my son was going to need a heart transplant. I was going to be moving to California and then 10 years later be speaking all over the world for Invisalign. I mean, who would have thought? So you don't know what your next move is, right? You really don't. You think you do, but you don't. So with that all being said, I'd like to share with you today, first of all, like why I do so much Invisalign. So like if I do Invisalign all day, like why is that? I'm not just out there like making people's teeth look pretty and smiles pretty. I actually have a purpose in mind when I'm doing Invisalign. Like I said, approaching airway. And then I teach all my general dentists in my group in Hawaii. And we're on all the islands, and we have a lot of general dentists, but I teach them all, just like courses like this, the value of occlusion, and then I teach them if they don't want to do Invisalign, like there's going to be people in this group that do not want to do Invisalign, and I hear you, it's not your passion. And typically in groups like this, there will be like 3 or 4 people only that will really get into doing Invisalign. Half of you guys will never do Invisalign, and it's just the way it is in dentistry. Everybody's got different passions. What's your passion in dentistry? What do you like to do?
I like doing implants.
Implants. See, everybody's got their gig. You like Invisalign. What's yours?
Aesthetic.
Is that cosmetics? Dr. Pope, you're kind of a all-around kind of guy, huh?
I just like comprehensive.
Yeah.
It's bigger case dentistry, yeah.
What about you?
Just make it a home at the end of the day.
Is that your brother?
Yeah.
Different mother, though?
Our voices are identical.
Different
You
mother?
close your eyes, you can't differentiate our voices.
Is that how you can tell?
Yeah.
Just from the voice?
Yes.
No, I kept looking at him and looking at you and go, wait a second.
I can't tell who's who.
Stereo.
And in our office.
No, so what's your
I
passion?
don't know yet. Right now, just
Did you
trying
just
to touch
graduate?
on everything. Yeah, the three of us just graduated.
Like, just like recently, like,
3 months ago.
wow, welcome to Lake Nashville. You're only 38 years behind me.
He's got 90 days.
Lots to learn then.
Yeah. And let's do this. So hygienists, like, if you were to look at your doctor and over time see him paying attention to occlusion, and I mean, you work with hygienists, right? And don't your hygienists like comment to you like when they see your patients that you've completed Invisalign on? Like, isn't it amazing like the shift in perio in someone's mouth that has a proper occlusion, right? I mean, you see that, right?
Right.
So what has that experience been like to you? So how long have you been doing Invisalign then?
10 years.
So what has that experience been like for you to see like what happens as a result of a patient completing, you know, aligner therapy and getting a healthy occlusion, how it affects their overall health?
Right, you feel like you really did do something positive for them. And that's something that I talk to patients about when I'm trying to convince them to do Invisalign is, you know, you're going to see these things improve. Things are going to be much better.
So what was it about Invisalign that made you do 300 cases? Like what was the thing that put you into this realm of orthodontic therapy? Like what is it about Invisalign that turned you on so much?
I think just in general, I just enjoy improving things for patients, helping.
And are you comprehensively treatment planning and involving that before you're doing any major restorative?
Preferably.
Yeah, so that's like what we're going to talk about today. That is the hugest thing, is that you'll see, like, and Dr. Pope saw when I spoke in New Mexico recently, I don't do any major restorative until I've addressed occlusion. And you'll see people will walk in with, you know, $5,000, $6,000, $7,000, $8,000 and they want to do veneers today, but they have an edge-to-edge bite, and I'm like, we can't do that until we address your bite. Otherwise, what I put in your mouth is not going to last. And the same thing if you're doing implants or implant bridges or anything, you know, major restorative wise, if you're putting it on a crappy foundation, i.e. when I say foundation, I'm talking about the bite, okay, the occlusion, right? If you put any dentistry on a crappy foundation, it's not good dentistry. Been there, done it, don't do it anymore. And really, like Dr. Pope knows, you have to take a stand on that, right? You have to be a firm believer that before you're going to be doing 8 veneers on someone that has an edge-to-edge bite, that you can't do that. It's just not proper service. So you'll see a bunch of cases today. I'm going to talk about that and go through that. So that being said, I'd like to start off with just talking about why I do so much Invisalign. Like, what are the reasons I do it? So that when you guys start doing your exams or you're a hygienist and you're cleaning teeth, that you, don't tell me I have to change my batteries already. Sorry. So when you're a hygienist and you're cleaning teeth, when you leave here today, you're going to be able to have conversations with your patients while you're cleaning their teeth, because it's going to be obvious to you when you leave here that you need to do that. And when you hand those patients off to, you know, docs like these guys to do the exam, you've spent valuable time as a hygienist going over occlusion and abfractions and recession and abrasions and attrition and all that kind of stuff that's so damaging, that when your doctor takes over and does the exam, he's going to feel like you're supporting him and getting the patient into proper treatment care, right? So like Adam was saying, I do practice in Silicon Valley and private, and I am in Hawaii. And it's pretty fortunate to live in these spots, you guys. I don't know how you guys feel about this, but when you see this stuff, like, it's pretty mind-boggling. I'm pretty fortunate to have this opportunity. That's my son who got the heart transplant. He's now a straight-A student in college, 6 years later, 7 years later, whatever it is. So let's start with this slide. Remember this slide, Dr. Pope? So I think this is an amazing thing. I went and saw one of our faculty members speak a couple years ago, and he had a similar type slide, but the same concept behind it. And that is, like, if you have a patient in the chair with that PA x-ray, right, and you've been out 90 days and you're so proficient at this, I'm going to go right to you. So if you have a patient in the chair with that x-ray, the conversation is kind of what? If I'm your patient and you see that x-ray and that's my tooth, what are you talking to me about?
Both treating the tooth and asking the patient how we got to this point.
Okay.
So endothelial crown, and then also talking about how did we get to this point? How is this not caught earlier when you have a small cavity and trying to address the whole mouth as far as other cavities are concerned?
You guys see how confident he is talking about this? He's only been out of school 90 days. This is my point. Follow this. Now, if a patient has sleep apnea, anybody here do any sleep apnea, taken any sleep apnea course, know anything about sleep medicine? The answer is always none or there's one. So basically it's none, right? So if you have a patient in the chair with either of these two conditions, and you've been out 90 days, and you say to the patient, wow, you know, you've got, what would you say to this patient right here? So if I'm your patient and those are my teeth, what are you saying to me in the chair?
Just talking about, I'm not sure, but I'd probably talk about.
That's like the perfect answer for me, by the way.
It's a constricted arch, there's no question, and there's a lot of crowding. And if he wants to have these teeth 20, 30 years down the road and in good health, the problem needs to be addressed now.
And what if I said, yeah, it doesn't really bother me?
It's gonna bother you in 20 years.
You can't even brush that.
I'm not
front
sure.
What, hon?
tooth. You can't even brush that front tooth,
Yeah, it's hard.
the anterior.
Are you a hygienist?
Yeah.
I love hygienists, are always so tuned in. So my point on this, is that it's super easy for you, even 90 days out of school, to have that conversation. Everybody understands that, right? But to have those conversations is way more difficult. And it's really hard to engage in a conversation about malocclusion if you don't, know anything about it, right? So what's the difference between talking about that or talking about those?
Education.
Exactly. What we learn in dental school is what we preach in practice. So your ortho program, where'd you go to dental school?
University of Tennessee in Memphis.
So remember your ortho program, if you're a doctor here, right? Your ortho program was about this long, right? I mean, I remember mine in San Francisco was like class 1, class 2, class 3, aloha, right? That was it. Like, they don't teach any ortho. And I don't know if it's on purpose because they want, all orthodontists to just do ortho. But they don't teach much ortho. And then how much sleep apnea do they teach in dental school? Like 0, right? And how many people in the US adults have sleep apnea that we think right now?
Yeah, like 60% or something.
Millions.
Like 80 to 90 million. And what percent are we treating of those 80 to 90 million?
20%.
3%. 3% is all we're treating. So, remember I said this in
What are the malocclusion numbers? They're probably
75%.
75% of the population.
75% of the population has malocclusion.
And what percent of that do we treat?
50% are class 1 crowding. Those are all your patients you should be treating if you're just even doing basics, right?
Yeah.
So I always tell people, if you're doing, how many exams are you doing a day?